Safety profile overall, very, very good. Nothing alarming. There's a number of questions that we've had that's more consistent with the myth that's on the internet. But at this point in time, very good safety profile. And as I said, the majority of people will have some pain, and that's about it. So COVID-19 vaccine, the mRNA-based vaccines from Pfizer and Moderna, and the vaccines that are in development as well, the more we know about it, the more we can speak about those. But now these two specific ones will not cause a positive mRNA test or PCR test, so to speak. You will not have a positive COVID-19 test based on these vaccines. If someone becomes positive after taking the vaccine, we're thinking this is because of some exposure before or immediately after. Keep in mind, it takes some time after taking the first and second dose for you to develop immunity and antibody that will protect you, right? But at this point in time, it's not a live virus. It's basically a message telling your body to create these antibodies. So it's not a live virus, and as such, it should not cause you to have a positive PCR test. Same question. So it will not give you COVID-19. It's not a live virus. What you could have, though, if you're looking at test results, and this is primarily for our provider group, I will imagine, and based on studies, it's not uncommon for you to obviously see an increase in antibodies very, very quickly. So if you do test someone, keep in mind the primary purpose of this vaccine is to increase antibody. So if you do an antibody test, I imagine that's going to be, and it makes logical and scientific sense that it will be increased, but you should not be positive on your PCR testing or any other COVID-19 test. The COVID-19 disease process does elicit some antibody, and like almost all other infection or infectious diseases process. But the COVID-19 virus, what it elicits, the COVID-19 vaccine gives you significantly more protection. So the antibody that the actual virus create or allows your body to create, that gives you some level of protection, and in some studies, some very good degree of protection for a period to extend over 90 days. But with the vaccine at this point in time, the antibodies that is created is significantly more. So there is benefits of getting the vaccine, even if you've been positive in the past. A few things to look at when you're looking at the Pfizer study and the Moderna study. So obviously a significant reduction in getting sick from COVID-19. And also the individuals, so let's look at the people who fall into that 5% category. Their illnesses were very, very mild, and I think that's one of the things we don't talk about enough, because we do have almost 95% protection. But what happened to these 5%ers? These 5%ers that did get the vaccine, did have some illnesses, still were non-critical, very mild, so it does give you some level of protection all the way through. And for a number of reasons. So the mRNA itself doesn't go to the nucleus of the cell. The nucleus of the cell is where your DNA material is housed. mRNA technology or mRNA itself does not enter into the nucleus of the cell, so it will not alter any DNA material.